Hey everybody, how's it going? This is gonna be a bit of a different video than the ones I'm used to do. It is very personal, but the reason that I'm doing this video is to help anybody that is searching any type of information to deal with this problem, right? So just to give a heads up, you probably saw it on the title, but I had heart surgery with 29 years. I have a mechanical aortic valve. And it was very hard to find online a lot of information about it. It's not that simple to search how to go through this process. So I didn't really know where to look, and I went to YouTube and I found a couple of videos, but nothing really tells to you face to face what are you going to expect, what you're going to go through, and it's really a life-changing experience. So I am making this video to help you who is watching this, or you're gonna have a heart surgery, or you know somebody that's gonna have a heart surgery. And obviously everything that I'm saying here is not a medical explanation. It's all based on personal experience, right? Each person has a different experience, and I am gonna talk about mine in particular, but maybe that can help you, right? Hopefully that's something to take your mind off troublesome thoughts, because it's not something easy to do. Okay, so I'm gonna try to keep it kind of short, but there's a little bit to go through to tell the information that I couldn't really find online. So, all right, here we go. So I'm gonna start from the beginning. And my problem was that I was born with a bad aortic valve. It was a bicuspid aortic valve, meaning that I was born with 2 leaflets instead of 3 leaflets. If you're watching this video, you probably know what that means already. But not everybody with this problem needs surgery, but a lot of people do. In my case, I needed to do it with 29 years old, and that happened after I went to a doctor in Canada. I live in Vancouver, to just check up for my residency card. And then he's like, hey, I hear a murmur here. And I told him, yeah, I know I was born with this bicuspid valve, but I've been doing echocardiograms every 2 years, and everything seems very regular, so I'm pretty confident everything is good. So the doctor said, yeah, you know what, I'm gonna double check that. So he booked me an echocardiogram here in Vancouver before giving me the okay, and to the PR, right? And then he, on the day that they were doing the echocardiogram, even the doctor doing it, he was like, yeah, you might want to change that. You might want to swap it. I was like, oh, this is kind of strange. Nobody ever told me I was on that stage. I had an echocardiogram a year before and everything was okay. So when I went home, I was born in Brazil to visit family. I went to 2 different doctors to do echocardiograms to confirm what he's saying. And the doctors there said, yeah, you probably want to change that in 4 months, right? Otherwise, you're gonna be at high risk of some fatality, right? And that's because I was already having some symptoms, and the symptoms were dizziness once in a while. Like even when I was sitting down on my office, sometimes the things were starting to spin a little bit, and I thought it was something with my eye or something with my pressure, but it was really a symptom of my disease. And you know, I was starting to, you know, feel not that powerful when running on a treadmill, while on the 30 years old I should be on my best training method, right? So they told me, you know, you're going to be at high risk. We recommend you to do surgery. And I had to think about doing it in Brazil or Vancouver, and I chose Vancouver because, you know, I live here, and they have really, really good hospitals. I'm going to talk about this later, and you know, it's just a first world. Besides all my family living in Brazil, I would have a better system support here in Canada, right? Plus in Brazil, I'll have to pay over 10,000 our money just for the valve. It was something ridiculous that they quoted me there. But anyway, I decided to make the surgery here. I didn't know if I was going to have to pay or not. And luckily, the Canadian healthcare system is excellent and they covered it. And I was very impressed actually. But that's great, right? You know where your tax money is going to. It is going to health for sure. So, okay, I decided I'm going to make the surgery, and you are probably at that stage right now, or looking for information about the stage. And there were a lot of things to consider when you decide to go through this. The first is to research, like what the hell is going to happen with me. To the doctor, I just told him, you know what, like I'm going to have to replace it at some time in my life. So just change it, right? What's the big deal? Change it. I'm going to go through some months of recuperation and then I'll be done with it. And then it's like, yeah, it's not that simple. And it's not that simple because of many factors, okay? And the first factor that I'm going to talk to you about is about preparing for surgery. And of course, each country is different and you will have to find a cardiologist, you're going to have to find doctors, go through many stages until they make you an angiogram. At least they did it with me, to make sure there's nothing else wrong with your heart, because maybe there are clots, maybe there are veins that are not good. And since they're going to crack you open anyway, they might as well fix whatever is wrong with it. So they're going to make you an angiogram. It can go, it's a little camera that go or through your arm or through your thigh. I don't even know how to call it. This is next, to a bad area. But the camera just goes straight in and you are awake and you can feel the camera going straight to your heart. And it's a pretty weird feeling, but it's nothing terrible. You're going to survive it. They're going to sedate you a lot, and if you go through this procedure, and they're going to examine your whole heart to make sure exactly what you need. In my case, there was nothing wrong with it. There was nothing wrong with the root of my heart, of my aortic valve, because sometimes bicuspid valves has problems with roots as well. Mine was just a valve, and they decided, okay, the only thing we're going to do with your heart is to change the valve. And then the surgeon goes and talks to you, and he gave me 3 different options, and he's probably going to give you those options too. They were pig skin valve, cow skin valve, or a mechanical heart valve. Now, I'm not going too much in detail about all of those 3 and what's good and bad, but what he told me and what I found online, right, it can be different, it might be different from person to person, is that the skin, the real tissue valves, they last for less time. So maybe 10 years, maybe 20 years, who knows, each body is a different body, but they expect it to be around this time. Hold on, let me get my clue back. There you go. What is the upsides of it is that you're gonna need to take anticoagulants for a little bit of time and then you'll be done with it. The downside is that probably if you're young, you're gonna have to do another heart surgeries, more than one maybe, to replace it. If you're way older, I don't know, 60, 70, you might want to take a skin valve because maybe, I don't even know how to say, but it's 10 years. It depends from person to person. Like, do you want to live with meds, or do you want to not worry about meds? So what I'm coming to say is for a mechanical heart valve, the expectancy of it lasting is longer. They still don't know exactly, but it might be from 25 years to 100. There is not enough tests about it yet, but they expect it to last a really long time, longer than a skin valve. The downsides of it is that it's a foreign body, right? Is a artificial piece of technology inside you, and your body just doesn't really like it. So you're gonna have to take anticoagulants for life. And I'm gonna talk a bit more about anticoagulants soon and what that really means. But then you will have to choose, like, do you want something that lasts longer? You might need another surgery, who knows? That lasts longer, and you take anticoagulants forever? Or do you want something that you most certainly would need more surgeries, but you wouldn't depend on anticoagulants, right? It's a tough choice, and it really depends on age. And I would listen to your doctor, to your surgeon. He will give you advice. He gave me the advice of going to a mechanical heart valve. Now, mechanical heart valves, there are many manufacturers, and I took a very new manufacturer that is called On-X. On-X allegedly lasts forever. It will outlive you, and you will need a lower coagulation level. So talking about it really quickly, it's a huge topic, and you can search more of it online. Otherwise, my video is going to be 5 hours long. It's anticoagulants. It doesn't thin your blood. It makes your blood coagulate slower. For mechanical heart valves, some manufacturers say that your coagulation level needs to be between 2.5 and 3.5. The On-X recommends between 2 and 3. That just means that you need to take a bit less meds depending on your diet. And it also says that you can be on 1.5 to 2.5 after a year of surgery. Now, some doctors might not like it. Some doctors might want to keep you at 2 and 3. That means that you're going to have very regular talks to your doctors, not visits, but he will phone you when you test your blood. So to test INR, to test this coagulation level, it's called INR, it's a international normalization something, that all the word came with those numbers to be easier on the meds. You will have to test your blood many times during your lifetime, many times a year. And your doctor will just call you, hey, your level is this, increase your medicine or decrease your medicine or change that, you know. And the important thing to know about the anticoagulants, and you can find a lot of it online, is that it interacts with vitamin K. Many people didn't know that. I didn't know that, how much of that would impact me. I knew it before surgery, but I didn't know how much that would impact me. But vitamin K is present everywhere. You can have vitamin K on Tiger Balm for pain. That can really mess your INR level. And every leafy greens, they have a lot of vitamin K. Kale and spinach have a very high dose of vitamin K. And lettuce, for example, has a very low dosage of vitamin K. So that means that to control your meds, I mean, some people say, oh, don't eat too much vitamin K because then you don't need to take that many meds. But that's not how it should be. You should control your meds by your diet and not control your diet by your meds. You know what I mean? You don't want to, you know, constrain yourself too much. You're going to have to change your doses anyway. So you might as well adjust the medicine to you and not adjust you to the medicine. So, you know, I used to love spinach salads, but since it has a lot of vitamin K, I was afraid that if I don't eat spinach salads for a couple of days, my INR would rise a lot, you know. So if you eat, it would go down. If I don't eat it, it would rise a lot. See, I'm a year after, I still get confused. But a lot of vitamin K means it will coagulate your blood, so your INR level will go down. If you don't have enough vitamin K, it will make your medicine work harder, so you will have a higher INR level. So you have to keep balance of it. So I was afraid that if I don't eat spinach salad for many days, my INR will go all crazy. So I just changed my spinach salads to lettuce salads, right? So Caesars, I just eat a bit of lettuce every day, and it's good to go. And then you can mix a bunch of stuff. A lot of people try to be really cautious about it. And sure, you're gonna need to be consistent. Your life is gonna be way more consistent if you choose a mechanical heart valve. If you eat greens, just try to eat a bit of greens every day. If you eat a lot of greens, try to eat a lot of greens every day. So it varies from person to person, so your doctor will have to give you advice on that, and you will have to research about INR. But that's something to keep in mind, okay? In my case, I just swapped spinach to lettuce. And okay, so you already know about INR and everything. So I'm gonna go straight ahead, and after I decided to put my mechanical heart valve, and studied about INR and what would impact, I'll have to prepare for my surgery. And it can be a really, really long wait. Some people can wait for 6 months. I had to wait between 3 and 4, I think it was 4 months I had to wait after my angiogram. And it's okay, you're not gonna die, probably, before your surgery. You know, your surgeon knows your case, and if it's urgent, he's gonna bump you on the list. But there's a lot of people that need surgery, so if he's keeping you waiting a bit longer, don't panic. He knows that your case is your case, and how in danger are you, right? Sometimes you just want to swap it because you want to swap it. It's your life. But don't panic. So you have to go to doctors and wait a lot. While you wait, you have to prepare for the first months of surgery. So if you don't have family in the country you're living with, get them to stay with you for a few weeks. If you have friends, get them to stay with you for a few weeks, or even get a caretaker number. And I'm going to explain a bit more about that later, about why. And try to prepare your house for a very weak person, like very weak. You're not going to be able to do laundry for a few weeks. You're not going to be able to do groceries for a few weeks. You're not going to be able to shower properly even for a few weeks. You know, that's a bit overcompensated. Like, of course, you're going to be able to shower, but like, you won't be able to lift your body a lot. It's going to hurt to go to bed. It's going to hurt to come out of bed. So prepare your house for it. You know, maybe get a triangular pillow to help you stand up when you're in bed. You know, get nice chairs. You know, try to get your house prepared for you being weak. Okay, this is very important. And then you just wait. You know, call your doctors and wait. After you wait a long time, the surgery time comes. Okay, and now I'm going to talk about my experience. Since I'm from Brazil, I was very lucky and very fortunate that my family could come and stay with me for a few weeks. So my mother came, my stepdad came, my sister came, and they all stayed in my house, in my little slum for a little while. It was a smaller house than this one. And that was 100% essential. You need to have people around you, okay? And I'm gonna explain why. So they came here and they took me to a hospital, to the hospital on the day of the surgery, and they were all talking to the surgeon and everything. And in the hospital, everything goes really quick, actually. It's not like that big drama that you might imagine from movies. Basically, they made me wait on a little room, and then they took me to another room where only one person could go at a time, you know, just talk to me. And then they didn't even, I can't even remember if they stick a needle in me or not. I don't think so. But basically, they put me on the stretch bed and haul me into the surgery room. And I had to say bye to everybody, you know, to my family. It's like, okay, I'm going to be back soon, hopefully. You know, it's very, very scary. I'm not going to lie to you. Like, they are going to shut your heart down, and they are going to shut your lungs down and transfer all your vitals to machines. So it's kind of freaky. That's how it's done, and that's how it works. It's a very common surgery, so don't freak out about that. You're not unique there. There's a lot of people. That's why there's a huge waiting list. So they know what they're doing. There's very little risk, unless you have another disease that might affect you. But there's very little risk of something major happening in that surgery, especially if you're young. So, you know, they put me on that room and they put the mask in my head, and I just looked to the nurse. I don't know who he was, and he saw that I was in panic, and then he's like, why is it always the tattooed people that get the scares? And he saw that I had a bunch of tattoos, and then I just remembered that, and I was gone. You know, it was super quick. The thing puts you to sleep. Done. You're out. I don't know what the hell they do with you there, but they do crack you open. There are options of going through the side of your heart, but most surgeons don't like that option yet. They say it's more risky than cracking you in the middle. So my surgeon recommended me to just crack me open halfway. He knows that works, so he did that way. But it's your choice, it's your surgeon choice. Recuperation time is about the same. It's just less invasive, and you're not gonna break your rib in half. they break you from your neck until halfway through your belly button, by the way. So it goes all the way down. You're gonna see in the pictures. I'm talking to you, but I'm probably sliding pictures in the back, so bear with me. Okay, okay, then what? I just woke up, right? And I woke up in the ICU, and immediately I could feel that the pressure of my chest was long gone. I couldn't feel anything anymore. And I couldn't even hear the beating of my heart that I could hear before. You know, if I put my head on the pillow before, I could hear the reflux of the heart. It was like, it was very strong. And I was asking people, like, do you hear that when you put your hand on the pillow? And nobody ever heard that. Maybe just because I'm a sound designer, I don't know. But I woke up and I immediately was like, hey, I don't hear anything. That's, you will hear something, but I didn't hear that. And I was very sedated, so who knows what the hell state I was. The only bad thing that happened with me was that in the middle of the night in the ICU, by the way, crazy good ICU, you have full machines, you're seeing now in the picture, there's a lot of machines next to you, and there is a nurse or a doctor right in front of you with a table, only pay attention to you is mind-blowing, the care that they take of you. But anyway, you're 100% safe there. But what happened with me is that I had some kind of reaction to the what's the name of the thing? To the anesthetics that put you out, or for pain. I'm not sure which one it was. They did test me for that, and I didn't show any problems. But something happened. You know, things happens, and I just started to want to puke a lot in the middle of the night, and it was the most insane amount of pain that I ever had. Good thing it just lasted for a few hours and I can barely remember it. You won't remember anything. But, you know, I remember just like waking up with this, oh my God, I need to puke. And you are cracked open and everything hurts, and they gave you a little pillow to hold on to, and it's like, oh my God, you try to make power to puke, and you're in pain, and it was just insane. But it ended quickly. It wasn't something that lasted 4 hours. It was just, I woke up a couple of times like that. And then in the morning, I was good to go from the ICU. So I only stayed 1 day in the ICU, and then they put me for 4 days in the hospital room, and I was gone. That was it. I was 5 days in the hospital, and then I was home. Now I'm gonna talk about your stay in the hospital and what you need to do. So they're gonna give you a pillow to hold on to. So you're gonna have to make your lungs work again because they were collapsed since they shut it off. So you have to cough hard. It's gonna hurt, but you just have to do it. And every time you cough, you're gonna have to really hold this pillow, because this pillow is gonna protect your sternum, right? So then it doesn't, make too much pressure. So you're keeping it all together there while it's in that stage. And when you sneeze, you're gonna have to hold this pillow. When you stand up, you're gonna have to hold this pillow. Anything that you're gonna make a little bit more power than being awake, you're gonna have to hold that pillow for a little bit of time. And they're gonna explain that to you very well. And you're gonna have to, in the first day, right away, you're gonna have to start doing exercises. Now, I forgot to mention, I had the tube in my mouth on the ICU. As soon as I woke up, they took it away. I didn't have to stay with the tube for more than 10 minutes awake. I woke up, tube out, done. I also had drains and a catheter, right? So that stayed for a few days. The catheter is that they can give you the medicine in the hospital without you having to swallow anything, and the catheter so you don't have to go to the washroom. So in the hospital, you're gonna be hooked up to those machines, and right away on the first day, they're gonna get you to exercise, to get you all working. So coughing is a good exercise for the lungs, and you're gonna have to start walking. So they start with 10 minutes of walk. You're gonna walk like a grandpa, and it's gonna hurt, and you're gonna feel like shit, but you just have to do it, and it only lasts for a little while. And that's about it. It's the stay at the hospital is pretty quick. You don't have time to be bored because you sleep a lot of the time, and your friends will visit hopefully, and get people to be with you. Get your mind of things, and you're gonna sleep a lot and wake up and forget things. You're gonna be on a lot of medicine, so they're gonna give you huge painkillers. They're gonna give you your warfarin, that is the medicine to control your INR. They're gonna give you, you know, heart pressure, but you know, they're gonna keep measuring you and give you a ton of cocktails, the, the medicine type, and get you to exercise 3 times a day, to physiotherapy, you know, with a group there, you know, anything that keeps you moving, they're gonna make you do it. And then you're out. It's really, really quick. If you don't go to any trouble, which you shouldn't, uh, the hospital is the least of the scary parts, you know, the stay at the hospital. After that, you go home. So I took a cab, went home, and that's when it gets a little bit scary because, you know, you don't have more machines. They unhook you. By the way, the catheter and the tubes, they took after 2 days. Then I was on my own, right, walking around. Sorry, 3 days. On the fourth, I left, and I only left on the fourth because my R&R was a bit off. So they changed my medicine, and they just want to make sure I was all right to go home. So yeah, you go home, and people need to help you, right? So lying down hurts, and you have to use your pillow. Standing up hurts. You feel very tired. You get really moody, right? You're gonna get angry, you're gonna get sad, and then you're gonna get happy. You know, it's your hormones are all over the place, and your brain is all over the place too. But you know, that's life, and you just have to to live it. You know, a lot of people get depressed, saying like, "Oh, why did this happen to me? I had to have heart surgery." You know, you just have to suck it up. It's in you now. You have a new valve, so learn to live with it. It's the only way to put it. Like, there's nothing you can do. It's there. Don't blame. Don't get sad. Don't get depressed. You're gonna get mood swings because of the meds and, like, you know, all this change that is happening to you. But it's all gonna go away. Okay, so okay, when you're just gonna have to suck it. Basically, you know, it's yours. You're gonna have to deal with it. Don't get depressed. It's just it's not that bad. You see, I'm talking to you. It's been 1 year and I'm perfectly fine. I think. So okay, at home. So get help. A lot of people to help you to do groceries for you. You won't be able to lift more than 6 pounds, I think, for 6 weeks, or 4 kilos, something like that, for 6 weeks. You won't be able to drive for 6 weeks. No laundry. Nothing that swings a lot, like playing golf or, you know, throwing something at somebody. Don't do that. Anything that you can do to protect your sternum, to heal the best way possible, do it. You know, hold it tight. You don't need to be holding your pillow all the time. You know, you need to walk normally. But if you're doing something strenuous, hold the pillow. And then to the exercises, you need to increase 1 minute of walking every single day. It's not by distance. You don't need to walk faster. You just need to increase the amount of time that you do it. So, you know, if you can walk on ground floors with not many ramps, but include one ramp here and there, you know, try to get some stairs here and there, you know, you gotta make your heart start pumping. But if you feel tired, just stop, right? It's exercise. So I used to do 4 times a day. You know, my mother is a gym maniac, so she helped me with that to walk a lot. My sister wasn't here yet, so, you know, we walked 4 times a day, 10 minutes. When I got home, I was already on the 15 minutes. So you're gonna have to increase a minute until you reach an hour. Once you reach an hour of walking, you know, I did it twice a day, all hour walks, and I couldn't feel a thing anymore. I was feeling mood swings at night, when before dinner time, because I think my pressure was falling down, because didn't eat well, because I wasn't feeling very hungry. So I was getting very dizzy by dinner time. I got scared of that, but after I ate, everything went back to normal, and I put all my weight that I lost back already. But that's how I go. So you're gonna lose some weight on the surgery probably, by the way, but it's all gonna go back to normal later. Don't get too happy. Um, you're not gonna be able to work for 2 to 3 months. That's what they recommend. Uh, Depends on your type of work. I'm a sound designer, so I sit on a studio. So the doctor told me, you know, you don't need to wait all the 3 months. You know, when you feel good, just go. After 2 months should be fine. After you're done all your exercises, and you are able to go to work, just go to work. But he said 2 months because your mind is still a bit all crazy. You know, like you're back at the office, you won't be able to concentrate 100% on your first weeks because you're still like, holy shit, what happened, right? But you're gonna get used to it really quickly. I was very happy to go back to work as soon as I could. You know, I couldn't bear just being bored anymore. Uh, I like to go out all the time. But that's about it for the first 3 months, right? You're just gonna have to keep taking your medicines. A good tip, like that my sister gave when she arrived, you know, a day later after my surgery, I think, something around that, or 2 days later. It's to, if somebody can push you, just rent a damn wheelchair, because it's awesome. It was the best idea that she ever had, because you know, they were in Vancouver, they were being touristy as well, right? I was cracked open, but who cares? We got to enjoy the day. It was sunny, it wasn't raining yet, so let's just go out. I don't want to be walking around my block for 2 months. That's crazy. I would die of boredom. So they rented a wheelchair, and you know, we put the wheelchair in a cab, go somewhere that they wanted to visit, and you know, I would do my exercises there. So I would stand up from my wheelchair. Everybody would look at me like, "What the hell is happening? He was in a wheelchair." It's kind of funny. So you walk around, you do your exercises, and when you're tired, you have a seat right underneath you, right? So it's a great idea. It's not required. I just thought it was genius because we were able to visit all of Vancouver with me cracked open in the middle. And it was a lot of fun, you know, when you're out and people are just, you know, pushing you while you're not doing your exercises, the time just go by way faster. You know, just keep busy is the best advice there. You know, go explore new places. If you don't have anybody to push you, take a cab and go to an area where you know where they have benches, you know, at the park. Walk a little bit, then sit down on a bench for half an hour, then walk more, then take another cab and go away, or go to the mall, you know, whatever. It's just exercises that you need to do to help you be busy and not be in the same place all the time. You don't need to feel scared. Nothing is going to happen to you, most likely, right? You're already done. The hard part is done. So I'm just going, I wrote a few topics here. I hope I don't forget anything that I couldn't find. So yeah, oh yeah, I forgot to mention, of course, if you choose a mechanical heart valve, you're gonna click. I don't know if you heard it already, but I'm gonna stop talking for a few seconds to see if it goes through my microphone. It's like you have a little cricket inside of you, or a clock. People call me the Croc from Peter Pan, or cricket, or ticker, or whatever. You feel like I have many nicknames already. And you're gonna hear it loud and clear, probably. Some people say they don't hear it, but most people's like, what the hell is this? It's driving me nuts. And it drove me nuts. Good news is your brain is just gonna tune it out after a while. You know, like a lot of people say, oh, this is gonna make me crazy. The ticking, I can't bear the ticking. First of all, only you're gonna hear it unless you're like right next to somebody's ear. You are hearing it louder because it's resonating on your whole body. You know, your chest is a big resonating chamber, your skull is a big resonating chamber, and this thing ticking inside of you is just going through all of your chambers, going straight to your ear because it's inside you. You're hearing it louder than anybody else. And for me, after 2-3 months, I even forgot about the clicks, seriously. When I'm talking to you or when I'm like doing my day by day things to do, I don't even remember I click. In the beginning, I noticed it a lot. It was driving me nuts. To sleep was a bit hard. So a good tip is, you know, keep a fan nearby so you can buzz it, or a white noise machine. Anything that makes a constant noise that it doesn't change too much over time will help you sleep because it's a constant atonal noise. And also will mask the clicks a little bit. So you will get used to it. I did. By the way, like I mentioned, I'm a sound designer, and that does impact my life a little bit. I need to record for a living, meaning that is very, very hard for me to perform sounds, you know, like if I'm performing something like me tapping, like a microphone recording me tapping something for a movie or whatever, the microphone is gonna get my clicks, and it's very hard to remove it, so it's very time consuming. If I'm recording dialogue like right now, I'm gonna have to post-process it. I'm not going to post-process it because I want you guys to hear it how it is raw. But if I'm recording something more serious, like a video for school or a YouTube video, I'm gonna have to post-process it to help to reduce the clicks. They're not gonna be fully removed. And if I'm recording, you know, cloth for a movie, something delicate, or paper, turning around, you know, for whatever reason, for a movie or a game or anything, my clicks are going to be in the way. So that does get in the way of my job. But that's literally, besides being a sound designer or being an actor, those are the only two types of job that I can think of where the clicks is going to impact you. Besides that, there is no problem at all. So if you're an actor, I don't know how you're going to deal with it. Most people online said, you know, sound people said that they already mic'd some actors and they could hear the clicks, but it wasn't a big issue. They worked well in the movie. I can say I have never recorded an actor. I know that for me, I can hear it, and I don't want to be recording a lot of stuff with that clicks interfering in the way. So if I can record somebody else, I would do that. For my day-to-day job, besides recording, no impacts. You know, I work with sound, I work with music, I work with games, with movies. My brain just tuned the clicks out, and I can fully focus on whatever I'm doing. You know, it's okay. Besides that, you know, what else can I say? I talked about, right, a very important point too. If your hospital or if your city or your medical plan offers, there are cardiac rehabs programs, and that's just amazing. So what is the cardiac rehab? I started 2 months after my surgery, 2 or 3 months after my surgery. I was already back at work when I started, because there is a lineup for it. But basically, they're going to put you on treadmills with all sorts of equipments, and they're going to start making you walk, making you run slowly, and, you know, do the rowing machine and lifting weights very slowly in a controlled space. And they're gonna tell you, okay, you had no issues walking a bit faster than normal, let's incline it a little bit after a couple of days. Then they incline it, they measure you, they make tests and say, okay, you had no issues, let's start running with inclination. And you know, it's a very safe and great way to ramp up to your normal activities, you know, to start walking faster. I love to run. Well, I don't love to run. I run because I want to, you know, lose weight. But anyway, I usually run every day. And going to the heart rehab program was the only way that I was totally peace with my mind that it is safe to run. You're going to be a bit scared of doing exercises sometimes, especially in the beginning. But, you know, if you go to a rehab program, or if you increase your exercises slowly, it's going to be totally fine. It's, you know, the program for me lasted for 2 months, and I went bi-weekly. Some people last longer, but since I'm very young and I'm very active, and I was already walking to work, I wasn't biking yet, but was walking to work long distance, like 50 minutes walk and 50 minutes back with inclination, and that was my daily exercise. On top of going to the gym, I was walking at the gym on the days I wasn't going to the rehab program. And in there, they were making me run, and they were making me do the bike, and they were making me the rowing machines and lift weights. And they told you, okay, now it's safe for you to lift a bit more weights, and now a bit more. And then you're like back to your normal routine. And you were all under supervision, and that's great. I totally recommend it. If you can, do the heart rehab program after your surgery. It's really, really, really good. There's nothing bad about it. You know, it's after work. They pay attention to you, and you're safe, and you go to your routine faster than normal. Now, a year after, just as a reference, I run a lot. I run about 4.5 miles every single day, except the days that I'm being lazy. And I bike to work back and forth. I lift weights. Now, one thing that they say, like, you shouldn't lift very, very, very heavy weights, the ones that make your face purple, because that increases the pressure on your heart, and increasing the pressure on the heart is not that good for your valve, right? It might extend your root. You know, it might make your heart grow a little bit, which is not very good for mechanical valves. But, you know, I know a lot of people that have, not a lot, online, a lot of people that have this problem, and they do weightlifting and they are okay with it. And a lot of people that say that it's extremely dangerous to be a bodybuilder, for example. So talk to your doctor is my best advice. My doctors told me, you know, take it easy on the weights, you know, still be healthy. You can push yourself a little bit. You just don't need to get 60 pounds in each arm to do something. You know, I do 30 pounds in each arm, and I think it's pretty okay. Besides that, running, no more limits. You know, biking, no more limits, is all back to normal after a year. So 6 months after the surgery, you won't feel any pain on your sternum anymore. You know, even after 2 months, you even forgot that you do your surgery sometimes, and you go lift something, then you feel this sharp pain. It's okay, just don't lift anything. After 4 months, you know, my studio door was a bit heavy, and I had to push it with my shoulder instead of opening up like a normal person would. Just because it's a very heavy studio door, and you know, it hurted sometimes, but you know, with my shoulder was okay. So if you're going to lift something that is heavier than you should, you are going to feel it until 6 months. And after 6 months, I felt nothing really. And even, you know, like I said, after 2-3 months, I forgot that I had it until I had to lift something heavy. And then I remembered, oh yeah, heart surgery. And then, you know, back to normal. But after 6 months, you're having no more pain. You're taking way less meds, except your warfarin, a pressure controlled medicine. You know, I'm taking a quarter of this medicine, and my doctor wants to take me off it pretty soon, which is good. And you know, I'm taking aspirin. So just to be clear about those, I'm going all over the place, but it's okay. Warfarin is anticoagulants, so they will reduce the coagulation time of your blood based on your activities and vitamin K intake. It's not a blood thinner like everybody says. It doesn't thin your blood. You just make it less coagulant, meaning that if you cut yourself, you're going to bleed for longer. You know, it's going to take longer for it to stop. That's why people say blood thinners. So be careful with cuts. Be careful with shaving. Be careful with, you know, activities that might cause you bruises. Bruises might be a little bit dangerous. So I would say don't do MMA fighting, you know, against other people. You should, if you train boxing, it's okay to train it, you know, and punching the bag. But if you're receiving punches, not such a good idea. But besides activities that can leave a mark, you're all good to go. You know, I even went to those trampoline jump things, and you know, that was 8 months after my surgery, and I just jumped very wrongly, very fast, and my knee went straight to a box on the part that wasn't padded, and it was very purple, and I was even scared, like, holy crap, this is bad. But you know, it went back to normal. It wasn't such a big deal. The only, you know, you have to be careful with bruising, is what I'm trying to say. Because, you know, it might create clots. You don't want clots in your blood, because the clots can go through your heart and to your brain. And talking about that, the reason you have to be within the INR range is if you are below the INR range that your valve recommends, you are in risk of clots, meaning that a clot can go to your heart and you can have a heart attack, and the clot can go to your brain and you can have, you know, the brain thingy where it just shuts down. I forgot the name now. It's not aneurysm, but something like that, you know, like when a clot of blood goes to your brain vessels and it just shuts down. But you can have that, so you have to be very careful with INR. And if you're way above your INR level, you can start having internal bleeding, and you have to measure your INR a lot. So internal bleeding would be, you know, if you are INR, I don't know, 5 or 6. I don't know the numbers. Don't take the numbers that I'm talking about. Each person is a person again. But if you're in a very high number, you know, and you received a punch, or well, I don't know, something happened inside you, you might start bleeding internally. Or even if you brush your teeth too hard, you might feel that, you know, there's a lot of blood. That never happened to me, because my INR was, you know, usually within the range. It's off sometimes, but it's fine. It's not that much off. But you know, you have to be careful to be always in range. And to be always in range, you have to take blood. I go to a clinic bi-weekly, sometimes, usually, now I'm on 3 times a week. So not 3 times a week, every 3 weeks. So every 3 weeks I go, I collect blood. On the same day, my doctor calls me, hey, your INR today he called me and say, hey, your INR is 2.2. It's a bit lower than what I wanted because I'm between 2 and 3. He wants to keep me between 2.5 and 3 because he thinks it's safer. So I respect that. So I say, increase your warfarin by half and test again within a week. So every time you adjust your medicine, do the test again after a week just to see how it reacted. And then you can be back to every 3 weeks, every 2 weeks, whatever your doctor told you. In the beginning, you will test it a lot. I was testing twice every week. So I went for twice every week, and when it was in range, I was testing once every week for a month or so, and after that was in range, I was testing once every 2 weeks, and once that was in range for a long time, then I started going every 3 weeks since the doctor thought it was safe. But now, since I'm making an adjustment tonight, I'm gonna test again within a week. So you just are gonna have to learn to deal with it. And I'm gonna put a picture up there too, but there's this little machine that you can have that's called CoaguCheck, where you prick your finger. It's just like those diabetes machines, but way harder to find and way more expensive for some reason. You can buy it on eBay. You prick your finger and you put it on a little on a lancet, not lancet, the reading stripe, and it will tell you INR. And I tested already on the same time that I took blood out, and the day that I tested it, it said that my INR was 2.2, and my blood test told me was 2.3. So I would say it's close enough. Still, the safest thing to do is collecting blood, but some countries already test with those stripes. So it depends from country to country and how your healthcare service works. But I recommend buying it, especially if you go traveling. So I went back to Brazil end of the year, and my INR was higher than normal. It was 4.2. I was a bit worried. It's still not very bad. If it's higher than 5 or 4.5, it's like, oh crap, you might need to do something about it. So I just took a couple less warfarin pills, and I was very scared, but it was okay. So I had my lancets with me, so all I had to do, I landed, I tested it again. It's like, okay, it's still not down, so let's keep a lower warfarin level. I was, talking to people to see, like, how should I handle this? Should I take less pills? Usually you shouldn't take less pills until your doctor tells you to. My doctor told me, okay, you can lower it for a few days and test it again. So I kept testing every couple of days until it was back to normal, and then it was great. I went back to my normal dose. I don't know what made it go higher. I think my dose was too high because it went higher again later. So after testing a few times, my doctor told me, okay, reduce it by that amount forever. And I was in that amount until now, like 4 months on that amount of warfarin. And now I am a little bit low. I'm still within range, but he thinks I'm a bit lower, so I'm increasing half a pill. And I'm gonna test it again. So, that's gonna be part of your life, and you're gonna be used to it. So lancets, they help taking your mind out of trouble. It's like, oh my God, I wonder how my INR is, and you don't want to go to a clinic. You prick your finger, good to go. You don't need to over stress about it though. If your doctor tells you to test it once every week, test once every week. Don't go crazy about it. I was crazy about it and made me very stressed, but I'm here, I'm alive, and I never made any changes besides the changes that the doctor told me to do. So chances are you're going to be safe to do whatever he tells you to do. So, I think that's about it. After a year, your bone should be 100% healed, your sternum. And, I feel no pain for a long time. I do all my activities for a long time. I went to heavy metal concerts. I've been in mosh pits. I've been to theme parks. I went to the droppy tower thingy. Some people say that you can't go on roller coasters, but my doctors told me, yeah, you're totally fine going on roller coasters, skydiving. Everything is fine unless it has a very heavy impact on your body, physical impact. If it has a physical impact, then it might be a bit dangerous, but, better safe than sorry. Other thing to consider is, if you drink a lot, you're going to have to reduce it. I loved to drink beer on the weekend. The doctor told me 2 beers max, 2 pints max per day. And you can't stack days. You can't do 4 beers the next day if you don't drink the day before, because it affects warfarin and it can create blisters on your stomach. I'm not that much of a good boy, so I upped myself to 4 beers per day on the weekend, and it seemed to be fine. You know, you have to live too, right? You can't be all self-contained forever. So, you know, you go on a bender once in a lifetime. One of this medicine, you just have to be very careful. You know, try to not fall down and hit your head on the floor. That's gonna be dangerous to you. Uh, Try not to get on a fight. That's gonna be dangerous to you. And there are a lot of things that can be dangerous with physical contact. That's why they don't want you to be drinking a lot or using crazy drugs, because it might affect your INR. But the most dangerous thing is, you know, the blisters, internal bleeding, or hitting your head somewhere or getting hit by somebody. All right, so I think I've talked long enough, and I hope your mind is a little bit more at ease. And if you're having a surgery, good luck. Don't be too stressed about it. It's all gonna be fine. You know, I'm 100% normal now. Besides, you know, having to take medicines forever, but that's just my life now. Maybe you take supplements every day. It's just the same thing. It's just different pills, and you know you can do a bit less stuff, but whatever. At least you're not dying of, you know, going uphill on a street. You know, everything is back to normal, and you know you won't be depressed if you just take it as, you know, this is just another thing that happened in my life. It's gonna be all good. I see it that way. You know, when you watch movies and people are doing heart surgeries, and when you watch series, like, you're gonna be like, oh yeah, I had that thing, and then you're gonna think about it for 5 minutes, and then you're gonna be back for normal again. So it's normal. Everybody thinks about it. You had it, or you're gonna have it. It's part of your life. It's part of your experience. It can be traumatic, but you know, hopefully this video will help you to say that, you know, it's all gonna be good. There is no troubles. I am a year after, and I'm done. And oh yeah, a few more tips that I have for you. If you're watching this video too, you probably are searching about it. So if you are on Facebook, I recommend searching Facebook groups about it. You know, people ask questions, people answer questions. It's a very active group. I'm a member of Mind Ticks. It's an excellent group. You know, I have a question, you know, half an hour later, 10 people answered my question with their thoughts. And people that have this problem, people that have different experiences, younger people, older people, you know, usually they're pretty good, and usually the answers are accurate. There's also called, you know, Heart Surgery Survivors is another group. The Zipper Club is another good one. People answer a lot. So, you know, I'm always reading and answering when I can on Mind Ticks and Zipper Club on Facebook. There's a lot of forums online, and there's a little bit of videos on YouTube, and now this one. So hopefully that helps you. And all I can say is good luck. If it's not you having the surgery, be present for the person that is having the surgery, because they're gonna need it, especially in the beginning. And you know, life is life, and it's all back to normal. So good luck, and maybe see you later.